It's going to get a bit ridiculous, I'll tell you now.
All right. Our guest today is Dr. Kwadwo Kyeremanteng. He's an ICU doc in Ottawa. He's actually the head of critical care at the Ottawa Hospital. As a researcher, he's interested in using ICU resources more efficiently and improving access to palliative care in ICU. To help do this, he founded the Resource Optimization Network, a multidisciplinary research group working to reduce health spending in this area without compromising care. In September 2019, Kwadwo launched his podcast, Solving Healthcare, which feature interviews and discussions on the topic of improving healthcare delivery in Canada. And we'll definitely want to chat about that today. And then during the COVID-19 pandemic, some of you may have heard of that, Kwadwo created Solving Wellness, which is a virtual health and wellness platform for healthcare professionals by providing health, fitness, and self-care for its members because burnout. Kwadwo, thank you for joining us.
Well, thank you for having me. I know this has been a long time coming. I mean, you and that, like Andrew and I have been connected for a while, and this is the first time I'm seeing your visage, so I'm pretty excited about it. Tommy, you're pretty. Don't you both are like pretty in action, so I'm ready to go here, boys.
He's got his
I'm ready to go.
giant head floating in space there, Tommy.
It's an external image of what happens inside my brain as well.
All right, Kwadwo. So, I mean, the conversation is going to go where it goes, but I just wanted to start by addressing cardiometabolic health as it relates to the pandemic, because that was the pretense for having this conversation. And I know you've been on a bit of a speaking tour addressing that topic at a couple of different conferences over the past year or so, and you've covered a lot on your podcast as well. So, maybe you can just start by telling us what does the data tell us about what's happened to cardiometabolic health because of the pandemic. We knew it wasn't great before, but I think we all have a sense that things have gotten worse. So what do the numbers actually tell us?
I mean, Andrew, number one, thanks for allowing me to platform this as much as we can, because as you mentioned, pre-pandemic, this has always been a concern, but the numbers were very clear early in the pandemic. Data even I think coming out of China that like 90% of the patients that were critically ill had some form of metabolic syndrome, so like high blood pressure, obesity, type 2 diabetes. And what I found shocking throughout the early stages of the pandemic is that we weren't amplifying this message, especially after the first wave, where we were into a summer where we did have a lull. I mean, Tommy and Andrew, can you imagine if we were coming out with some energy saying, hey, this is what we're seeing. Let's collectively talk about ways that we could get all of us healthier, all of us improve our metabolic profile. What an opportunity that would have been, especially, the ability to get outside, the ability to exercise, and just talk about what nutrition options people can have. And so this was very clear in terms of the data. And then I don't know about you, Andrew, but in medical school, we didn't really talk about reversing metabolic disease. And so then I'm not sure how I came across it, but maybe it was some of the fans of the show actually just kind of referred on to some of the people like Jason Fong and Rob Wolf and Ken Berry and folks like that. And we're saying like, hey, we're helping people reverse their type 2 diabetes. And in a matter of potentially in weeks. So my mind was blown, and I was like, okay, this is the opportunity. Let's amplify this. And we developed some connections throughout the pandemic with like mainstream media. I was doing a lot of updates to locally and some nationally, and I would pitch it to people. I'm like, you guys know about this? Like the amount of obesity and type 2 diabetes that we're seeing. And there was no interest. This is what was driving me nuts. Like no one. Every once in a while, I'd squeeze it into the interview, and no one would follow up. And so I'm a big fan of just taking the bull by the horns, and so we just tried to amplify big time on our own platforms. Found as many people with that were seeing the light and try and essentially get the word out. And, I think there's still a lot of work to do, obviously, but I mean, my other take home when it came to the pandemic is, it's not only improving your risks of dying from COVID, but also cancer, cardiovascular disease, stroke, heart attacks. Like, all these elements are going to be improved if we improve your metabolic profile. So that was a huge driver. And even just to put some context into it, I know I'm blabbering, but even in that third wave, when we were seeing younger folks, it was still consistent. And in fact, it was almost amplified. Like, we had patients that were well over 300 pounds that were quite young. And so, they would be called healthy if you would look at their data, like if they were profiled on the news or whatever, because they're not on any medication. But unfortunately, like, when you can't walk upstairs like that, I'm sorry, that's not healthy. We all of us know that. So that's a bit of the background in terms of what really drove the message and why we continue to do so today.
And I mean, is that so? You're in the ICU, you see the sickest possible patients in the hospital. So I mean, I find it interesting in your case that you got so interested and excited about prevention, because I mean, you're on the receiving end of the end stage of many different things in acute care. So, I mean, you must have found it frustrating to start trying to platform that from your clinical position. But like, how did you kind of manage that tension when you're talking about prevention, whereas you go to work every day and you get people on ventilators, and in a lot of cases they're beyond reversibility.
Yeah, that's a good question, and it came from two places. So one, our research platform for me has always been on how to be more efficient with our resources and how to reduce healthcare spending and provide better care. And it was a big epiphany for me when realizing, if you prevent someone from walking in the door, that's a monster saving. I'll give a stat that often people balk at, but the average COVID ICU patient in Canada cost well over $50,000 per admission. You know what I'm saying? And so, like, if you think about what we could, like, how much that is, or even if you could, the opportunity cost of investing that money potentially in prevention, like, that's a lot of opportunity there. And then the second driver for the prevention side is I mean, what you saw in the pandemic for COVID patients in ICU was pretty tragic. Many people didn't survive, unfortunately. Like, our rates on average pre-Omicron, I would say, it's like 30 to 40% would pass. You saw people away from their families. You saw the fear in our colleagues when managing these patients. You would see it was just a lot of emotions around that, a lot of burnout. And then also just from the patients that actually did survive, like, it was not a great existence. A lot of them left ICU or home, or went home on oxygen, severely like lost their ability to do all those things that they love to do. So if we had the capacity to prevent them from landing in ICU, wow, this is something, to me, like, we should really push. And so, yeah, it's not maybe the conventional approach from most critical care doctors or critical care clinicians, but there was clearly some reasons why we wanted to avoid seeing people.
Is some of the pushback you were getting based on the timeline? Because once the pandemic was on the doorstep, I mean, it's kind of too late to reverse people's disease at that point. I mean, when you're talking about prevention, you need a 10, 20-year runway of interventions and policy change to probably really see an effect. And so, like, was that some of the pushback you were getting was, okay, well, that may be true, but there's not really anything we can do about it now?
Yeah, I mean, some of it was just, I'm gonna just call it ignorance. Like I was ignorant. Like, I know people, I know clinicians, I know the family members who literally have stopped taking their diabetic meds because of the interventions to, like, whether it was low carb fasting, adding resistance training, like going keto, like whether it was any of those combinations of things, or just eating whole foods, they come off diabetic meds. And to me, if people know they have that capacity, why aren't we selling it? Why aren't we amplifying it? Like, it's to me, it's bad. Like, I think people don't know. I think this is just ignorant. Like, you and I have how many years of medical education? I didn't know this till 2020. You know what I'm saying? Maybe you were more on top of this shit, but I thought once somebody was committed to their metformin and insulin, I'm like, here we go. This is the path you're going. And hearing these stories and then seeing it myself, I was like, let's get that message out there. And you're right, though, like, there's some of the bigger scale policy changes that we would need to see to more at scale, like making your city more walkable, having programs to make sure that we have access to cheaper food, like cheaper whole foods, for example. I think, yes, a lot of that would be years, but for some, if you gave them the right information and the right clinicians, those interventions could happen within weeks to months to years.
Yeah, I agree with you. And I've seen that clinically, absolutely, where people have come in with diabetes and all sorts of metabolic abnormalities, and within 6 months, they're no longer in the diabetic range, and they've lost 10 kilos of weight just from pretty simple interventions. So I think there's probably just a general lack of appreciation for how quickly things can actually change in the right direction with the proper time and advice. But of course, I mean, my medical education was no different. It's, we learn evidence for when and how to use medication and how to titrate medication. The only time we talk about deprescribing is when people are geriatric and they're starting to get delirious because of the medications that you're giving them. It's totally crazy. Tommy,
Absolutely.
do you want to jump in?
Yeah, I have a question, Kwadwo. So not even just related to the pandemic, but we know the tight connection between cardiometabolic disease, and not just diseases that are directly connected to cardiometabolic health, but even things like certain types of cancers, neurodegenerative degeneration. We know how close the connection is between your body, what you eat, exercise, your weight, and outcomes of those diseases and the ability to prevent it. So this is something that's well known even in government public health systems, but it's never at the forefront of the conversation as far as public health education. Annually we might come out with some sort of dietary review that becomes public facing, but it's never very sincere, and these are things that don't come up in the press or in government messaging very often. Do you have an explanation for why that is? Like, in your point of view, why is it that even though we clearly understand not just the health ramifications, but the economic ramifications of not pushing people to take care of themselves, why is this just messaging that does not pick up traction?
Yeah, no, that's a great question. I think one, and I don't know the exact answer, but these are the ones that come to mind. So there's this element of not addressing some of these issues because of fat shaming. I think is a concept that is prohibitive to have some of these honest conversations. And I'll be honest with you, Tommy, like, I didn't give a shit about like there's shaming, like proper shaming, or there's like bringing up an issue. Like, for me to not bring up the association with obesity and poor outcomes with any health conditions is ridiculous to me. Like, it's a risk factor, and if someone hears that, they might change their course and save their life. So to me, if it's a matter of, oh, but you might offend some, to like, toughen up. Like, this is a fact. You know what I mean? Like, so I've never been a big fan of not addressing an issue because of risk of offending some. The second concern, I think, with a lot of this is kind of what Andrew was alluding to. A lot of these policies or changes, like if you're a government agency, the results you're not going to see for years fiscally, or like when you look at the data at a population level. So by the time your election comes, you've invested all this money and you probably don't have that much to show for it. So you would need almost like the wherewithal to say, yes, like if I was king for the day, I'd be like, yes, you're not going to see this is going to hurt the budgets for a while, but by the time, X amount of years, 10 years from now, you will see that reduction in hospital utilization on stuff that really puts a dent into our costs. Like a lot of people, when I tell them the amount of, what is it, 1% of your gross domestic product goes to taking care of ICU patients, and a lot of patients do not benefit from landing in the ICU. So it's like, if you could even take a reasonable dent in the amount of people that are coming to the intensive care unit, that is a lot of cost savings. So I think that's part of it. And then, I mean, there's a lot of money in some of the bad foods, like, like, not to, I don't know, pick on anybody, but if a lot of the processed food industry, fast food industry, there's a lot of money, there's a lot of cake in there. So, and I think, I don't know if as a fact that they have influence, but I do think the fact that they have deep pockets probably would impact things as well. So, when it comes to the food guide and all these things, but that's totally hypothesis. Like, I don't know that for a fact, but that's just something that comes to mind when it comes to why we haven't been pushing a healthier agenda.
Yeah, well, there's certainly food manufacturers have influence over the research that guides the provincial and federal guidelines, right? Because someone has to pay for these food studies, and it's going to be the people who have an interest in making whatever food they produce look as good as possible. And the other side of that as well is this subsidy system that we create federally as well. So we subsidize soy, corn, canola, these foods that predominantly end up in processed foods in the form of like high fructose corn syrup. And we have all these farmers on board that we're essentially paying to overproduce all of this food, and it has to go somewhere as well. So it's also conveniently makes up the majority of our food guides, these foods that we subsidize. And for instance, just the amount of farmland we use to grow canola it is more than all fruits put together, all vegetables put together. The amount of farmland dedicated in the country just to grow seed to make canola oil is bigger than all fruits and vegetables put combined that are non-grain. So there's also these sorts of issues as well. So there's certainly influence there from food manufacturers.
I hear you. Can I ask I know it's not my show, but can I ask a question? Because I've been a bit grilled on this on social media when I said, like, we should be avoiding seed oils and so forth, and they're like, show me the data or the evidence to prove that. And I've never took a deep dive into it, but I don't know if either of you are aware. Is there like medical literature to support that, or is it just kind of derived because it makes sense?
Yeah, there's a few things. So most of the data is going to be either correlative or plausible. So correlative in that as our seed oil consumption has increased, we see all of these increases in incidence of disease and obesity and cardiometabolic disorders. But that's also in line with the amount of things like processed sugar that we consume. So it's hard to parse it out. But there's also the plausibility side that just by the nature of how hydrogenated oils are created and manufactured, and the opportunity for those foods to go rancid, to create reactive oxygen species inside of those foods, you can also have a theoretical argument that these would be foods that are more likely to be problematic in the human body. But this is one of those things where, unfortunately, science is always 20 to 30 years behind. And often what your own mind would tell you doesn't add up is what becomes the science in particularly nutrition 20 to 30 years down the road. And I don't think it should be controversial to say that the more you have to process a food before someone consumes it, the more opportunity there is for risk of consuming that food. And when you have things like butter, like ghee, like olive oil, and all of these other alternatives to these things like hydrogenated and highly refined seed oils, why consume those? Why consume the most processed thing, thinking that it's going to give you health benefits just because you can point to it and say, well, it's low in saturated fat? And that's the other part of the seed oil thing, right? It's we know the proposed connection between saturated fat and cholesterol and cardiovascular outcomes. Therefore, if this thing is low in saturated fat, it must be healthy without actually having any direct evidence of that either.
So you're saying that heating something up to a bajillion degrees under super high pressure isn't a natural process? Like, so yeah, I agree. I don't think the evidence is necessarily there for us to strongly say that you shouldn't do it. But when there's alternatives, which we know are good and better, then why not do those things? Like at the individual consumer level, there's no reason why you need to have seed oils in your diet at all. You can use olive oil, you can use avocado oil, you can use the ghee and butter. Like you could do all those things. If you're eating a whole food diet, you get to choose what oil goes into it. And those things absolutely have excellent evidence for being health promoting. So yeah, there's really no reason. There's also the, on the unsaturated side, the omega-6 argument that sort of circulates where omega-6 unsaturated fats may increase the amount of arachidonic acid, which is obviously pro-inflammatory. So that may or may not play a role, but there's the biological plausibility there. So you can hit them with that knowledge next time they,
I'm going to just drop kick them in the chest with knowledge.
Exactly.
I've never walked through the grocery store and saw something advertised as heart healthy and thought that's the best option of this type of food. It's always some sort of hyper processed food that ends up being heart healthy because they've manufactured the saturated fat out of it. And even though it's processed 6 times over, it becomes more healthy than something that's a complete whole food, just because of that chemical restructuring that the medical community will look at and go, oh, because it's absent this, it is therefore healthy. And that's really the medical nutrition mindset, right? It's embedded in research that really strips away intuitive knowledge about food. And it turns nutrition into like this medicalized system of, if it hasn't gone through this research lens and proven itself to be healthy, it can't therefore be healthy until it meets this research threshold. And it's just a ridiculous way to look at diet, I would say.
Clearly medical things are better in general, but yeah. So Kwadwo, I'm curious. So you've done a great job, getting the message out there, with your mainstream media interviews, your social media platform, and you've probably caught the attention of a bunch of healthcare providers who hopefully have taken up the gauntlet and started to change the way that they practice. I'm wondering if you've had any buy-in or opportunities to talk to people at more like the government's regulation or policy level, and if you've had any traction there.
Yeah, no, thank you for that.
You're in Ottawa after all, right?
Most of from the political side, it's always been more advocacy around, about, equity and just overall some of the COVID policies. But unfortunately, there hasn't been much in the way of energy from the like nutrition metabolic side. There was one organization that seemed a little bit like they were getting a bit excited about the idea of just promoting more activity, especially within our youth, but didn't really materialize to anything. That was in the middle of one of the waves when we were locked down at one point. But definitely from clinician side, like that's the part that has excited me, to be honest with you, where docs are starting to come to me, say, I want to learn more about fasting. I want to learn more about low carb or whatever. I want to learn more about the benefits of resistance training. Like that has been exciting. So it's been like nurses, nurse practitioners, a lot of residents and trainees, which is even more exciting if I'm being honest, because they're the future, and they're massive amplifiers. And then occasionally some staff docs have approached me and talked about it. And one of the more proud moments I saw was one of the ICU docs in one of the hospitals I was working at had a conversation about one of our extreme obese patients. He's always wanted to learn more about keto, so that staff doc didn't know much about keto, but knew it was a potential option for reversing metabolic syndrome, and asked me to talk to him and showed him towards some resources, brought the dietitian that was most comfortable talking about keto, and it just sparked that conversation. So that part has been definitely something that we've seen, and you also get some of these like amazing stories. I've kind of alluded to one of the docs I work with, first wave lost 30 pounds because of what he was seeing. Shout out to Tom Saris. I get a lot of stories from parents of clinicians that have come off their diabetic meds, which is so rewarding, honestly. Like it really is rewarding to hear that, because Tommy and Andrew, we're all doing this, having these conversations to try and make a difference. And when you hear there's some change, when you hear that you're making a difference, it's fuel, yo. Like it's just fuel to keep hustling. Because maybe we'll talk about it a little bit on the show too, but a lot of this stuff is not easy. Like a lot of this, whether we're talking metabolic health, whether we're talking COVID related topics, especially in a culture that is very, like when I think of the medical community, I do think we're not that. I think we're relatively narrow minded in a lot of the time. So, with putting yourself out there, there comes heat, and so you got to be willing to take the shots. And so but that the fuel comes in hearing the impact that you have on many lives, and that you could always look in the mirror at the end of the day saying like, yeah, it was worth the hustle.
So go ahead, Tom.
I was just going to ask, I did actually want to ask you about the COVID specific heat, because nutrition in the medical community alone is a controversial point of view for a physician to even talk about lifestyle related prevention, sometimes at the cost of medical solutions. So when you have alternative viewpoints, whether it comes to and I don't know all your views and all your public facing views during COVID, but having an opinion on things like lockdowns, maybe an opinion on things like masking very young kids, maybe an opinion on vaccination, a standardized vaccination strategy across all ages and all levels of risk. When you have opinions that differ from the medical community and you're putting those opinions out there publicly, what was that journey like for you, from pressing send on the first thing you put out there that you got a reaction from until like where you're at now with that stuff?
Oh man, Tommy, I'll say it was very eye-opening and humbling. I will say this, that even the fact that in the medical community I do think we have a narrow lens with a lot of approaches. There was always the safety of being able to talk about it, right? And then all of a sudden it was not safe to talk about certain things, like the risk of lockdowns early on. You couldn't say that. Like, and you got to remember, as an ICU doc, I think Andrew, you could appreciate this. Like, you can't be narrow focused with care, like with anything. Like if you have somebody that comes in with a lung problem, you start medications, you ask yourself, how's that going to affect their heart? How's it going to affect their kidneys? How's it going to affect their overall ability to recover? And one of the things we were missing during the pandemic was that holistic view. Yeah, okay, we could try locking down. First wave, to me, a lot of I forgive that because we don't know better or whatever. This was novel, but then when you realize that when you lock down, you're affecting kids' education, when you the economy, cancer screening, surgeries, backlog, all these things that will lead to poorer health and poor outcomes. We got to start having that conversation. When you have you start focusing on boosting everybody and not the people that need it the most, there's a risk there. Like when an 18-year-old that knows how to log on in the GTA area a little bit better than the 70-year-old diabetic that's obese, and they're getting their booster shot before anyone else, that doesn't make sense to me. Like we need to think about ways to achieve our goals. And so what it was like was, it was scary. So like a conversation my wife and I had when I started to get media requests was, this clearly is not a safe environment to be honest, to speak you the truth all the time, but is it worth it for us? And we sat down at the kitchen table and saying, like, this fear narrative, she's a psychologist, this fear narrative is going to hurt the public. It's going to hurt the future. It's going to hurt the way we think of public health. You guys speak up. It's okay. Like having that back, my wife and the family have my back was massive. But so you navigated through these things in a more politically correct way, but there was always lines in the sand for me when someone said, like, you need a vaccine before you could do in-person school. No, our low risk kids, especially when you think of racialized communities that have that specifically have some vaccine hesitancy, who've been affected the most by lockdowns, and now you're going to tell them that they need a vaccine before walking into a classroom when their risk is so low. No, that's not okay with me. Like there was always a line in the sand where I felt comfortable speaking up. I was never a fan of vaccine passports to walk into a restaurant. That doesn't even make sense. You're going to eat? How are you going to eat? You know what I'm saying? You think like no one's eating with a mask on. So like, you know what I mean? Like just passport, mask in the, actually that didn't make sense. What I was thinking about more masking in restaurants, passports, how it's allowed to be more discriminatory towards folks. Like, this is not Canada. This is not Canada that I know, being more of a stick than a carrot. Like that's not public health. That's not the way we operate in medicine, or even the way people were discriminating or saying like, if we shouldn't allow unvaccinated folks into the hospital and all that stuff. I'm like, who are we? What is this? I'm like, I can't not say anything. Like, like when they're saying we won't treat unvaccinated patients, like that is nuts. You took an oath. You know what I'm saying? This is against that oath. Where are we? Like, what's happening? So like, I know I'm going off a little bit, but the short version is having my family back me up and saying, hey, we're with you no matter what, knowing that if you don't say anything, there's going to be negative consequences. But I'll say this, Tommy and Andrew, like when you're asking about, influence on government policy and all that stuff, the real world, unfortunately, was tied to Twitter at the time. And I heard from government agencies, I've heard from news agencies that, a lot of their approaches and messages came from there. So that's why I hated it. I hated being on Twitter. Twitter is a devil. And so, but the reason we continue to put stuff out there was to try and like, so that we could have balance, so that some of this stuff would be less extreme. And so it was work. Like people have no idea. They have no idea the conversations behind the scenes. Like a lot of the guys that I won't mention their names, but the guys that are, we do a lot of media, we would connect and say, well, we need to have a united message about this school closure or this mandate. Like it was work. But honestly, I could look at myself in the mirror at the end of the day and say it was definitely worthwhile.
Good. Yeah, I wrote a public post early on, just stating like, parents of young kids need to have a choice in whether or not to vaccinate their child. And kids can't be barred from going to, this is when these conversations were happening, like kids can't be barred from going to school because it is a medical intervention and you're forcing the parent's hand to make an uncomfortable decision in a lot of cases. And just the deterioration of trust between people and public health alone is not worth the cost of doing something like that. And when I wrote that post, and it was a very sensible, thoughtful post that I put out there, I was just trying to support parents who weren't sure what they were going to do and say like, hey, you have the right to take your time in figuring out what you're going to do here. I had people that I know send me messages and say things like, my wife is a family physician, say like, your wife should be embarrassed of you for posting something like this. And initially those sorts of things hurt me a lot, but over time you realize those most angry and vile people, they fizzle out quick.
Yeah.
And you end up supporting a lot of people, because if you don't, I get the sense that you putting things out into the public, even though it's very difficult, a part of you probably does that because there's another side to the story that people deserve to read and hear about and feel supported in. And without people who are courageous enough to take the heat by saying something that is unfortunately controversial to say, when someone goes to look at the post of the other side, they can see a qualified person saying, no, wait, what about this? Here's something to think about. Here's a different perspective. Do you find it frightening how quickly in this country it became us versus them, to the point where average citizens would say, if you don't do this, you don't deserve medical care? When you hear stories about people being denied transplant surgery because they didn't want to get vaccinated, and there's a non-trivial amount of citizens saying, good, they don't deserve surgery. Because I would sit back and see those conversations, and then the level of comfort that the average person would have in saying an awful thing like that, and think, what are the people around me capable of if they can this quickly turn on their neighbor, their friend, their family member, just for having a different philosophical point of view in any given lane? Like, what was going on in your mind as you were seeing all this unfold?
I just couldn't believe how crazy it was. It was crazy. Like, I'm sorry. Like, we'll look back at this time and say, like, what the fuck? Honestly, like, like when you, exactly what you said, like denying someone transplant. Do you know what I mean? Like, this is the kind of conversation we're having. You had like, I put it into context a little bit. You got a racialized person who has a mistrust in the medical system from historic. Like you got, say you're from Sioux Lookout, where not even 30 in the late 80s, early 90s, they had segregated hospitals still. You do not trust like many healthcare professionals. You're coming in saying you need to be vaccinated. There's logically some hesitation, and you want maybe some more time, and we're saying no. And then you have a loved one that's dying in northern Manitoba or whatever. You can't get on a plane to see them in Canada. Like, do people really wrap their heads around that? Like, this is nuts. When we know at the time the vaccines work to protect ourselves. This is how it protects itself. The mask, that's what was used to protect ourselves. I'd walk into a room with a COVID patient coughing all over the place. They're not wearing a mask. I'm wearing a mask. So you have the tools. And then we still are going to ignore that and just put people through this kind of situation. It was nuts. And so, like, I think this is part of what my wife was talking about early on. It was like that fear narrative really pushed. Like, people were terrified. They were terrified. People, you watch someone mask outside. You imagine how much fear you have to have in your body to think that this is a logical thing to do. Like, this is where we were at, and so we produce this. Like, we collectively produce this fear, and when people are in a place of fear, they're not rational. They're not the same. And then you add a barrier like Twitter, give you whatever 240 something characters, plus promotes adversarial conversation. You're just building this mega anxiety provoking, fear provoking animosity amongst people and like it's hard to find the nuance in platforms like that. Like many people that I think that were on an extreme one side, if we sat down and talked about it, yeah, maybe they're still going to be more conservative, but it's going to be a more civil conversation. They're not going to try and stab me in the pelvis. Like it just, you know what I mean? Like it just, I think Twitter just provoked hate. And then with the mindset of everybody being at home and just all they're hearing about is badness, it was crazy. But still,
and this is why it's so crazy that the mainstream media is taking a lot of their news sources from social media, because social media is not representative of the majority of people. The majority of people are silent and not going to bring up issues in the public square. So to make it seem like the debate that's going on this social media platform is representative of most people's thoughts is totally insane. But then it sort of infuses the psyche of the general masses who are going, well, if I turn to mainstream media, that should be hopefully a properly curated source of information, and it's clearly not. I'm curious what kind of support or not you had from your colleagues, because my experience here was, I was not nearly as outspoken as you, but outspoken in some respects about certain things, pushing back on lockdowns and mandates. And when I would have a one-on-one conversation with somebody, then often there was a lot of agreement that we shouldn't be doing these things. But then if you were to be in a group setting or more of a public setting, you wouldn't see people, publicly disagreeing. So what was that like for you, kind of in your immediate circle?
Yeah, no, that's a good question. First of all, like I wanted to refer back to one of the things that Tommy said, like when you were speaking up and you got all that Twitter badness. Remember what the epiphany that came to me is like your supporters were just too fearful to speak up. That was one of the things that became very clear to me as we opened up and people would start to approach me with kind messages, is that just a lot of people were too afraid to speak up. Regarding how things were, how people approach me at work, like mostly, to be honest with you, it's been support. And I think especially in my field, like within critical care, we were seeing the repercussions of the policies of many of the policies, whether it was overdoses at the time, late cancer presentations. We're accustomed to looking at things holistically. So there was some like support. There was still a lot of people that would get frustrated at the people that were unvaccinated. So I did find having to try and remind folks, like, we should have a compassionate lens. Like, there are the quote unquote the anti-vaxxers that you see online, but a lot of people had great stories. Like I'll never forget one guy that had a really bad autoimmune disease, neuromuscular disease, and they were fearful if they get a vaccine that won't be able to walk. Like, that's a legit concern. Like you hear about somebody that had a bad the lymphadenopathy got really bad to the point where they were compromised their airway and they're hesitant to get a second dose. Yeah, that makes sense to me. Like, why are we, like, we don't need to be absolute about things. So there was a lot of that was an area that I think there was some dispute, but overall, like, the damage of lockdowns, the concerns about mandates, I think fortunately I got a bit of support. There was, some of the pushback, there was always some level of pushback, but amongst my immediate colleagues, it was quite supportive.
That's good. I'm not sure what happens in the future if we have something like this again. Obviously, there's all the variants and whatnot. I don't think COVID itself is going to pose the same threat that it has in the past couple of years, but there could always be something else. And I think probably about 6 months ago, I was reasonably convinced that there wouldn't be the appetite to be as aggressive about things. as we were initially. But now I'm not so sure. Like I feel like that people's memories are unfortunately pretty short when it comes to this, and there really hasn't been enough of a challenge, whether it's in the legal system or enough groups coming together to say, we really need to talk about what do we do the next time, because there really seems to be no actual plan or anything underway to go, like, these things are, probably should never happen again in terms of the aggressiveness of the lockdowns and whatnot. But at the very most, they should be the last ditch effort to control things. Like, say you did have something that was, mowing down young people in their prime en masse with a 30%, fatality rates. That's a totally different situation. How do we move forward from that? Obviously, it's a huge question, but
No,
like,
I
do you
mean,
have
I have a
any
lot of thoughts.
thoughts? Yeah.
Yeah, it was a motivator for our last show. So we did a live cast with Steph Burrell and Zane Chagla and Suman Chakrabarti about exactly that. Like, how do we prevent this from happening again? And I think it's going to take some. It's going to take some courage. It's going to take some like more people speaking up, because you're right. To be honest with you, Andrew, I thought, there was stages in the pandemic in general where I'm like, well, we're not going to close down schools again. And then lo and behold, this short memories, despite places in our own country not closing down schools and having similar results, we would ignore that data. So it wouldn't be shocking if we went back to our old ways, but I think many of us would be much more vocal, and there's going to be a lot more people that would put up in opposition to any kind of approach to this. Business owners now would feel more comfortable saying, like, what the like, look at what's happening to the economy, look what's happening to to the situation overall. Like, people will be a lot more brave, and especially now that they've seen the damage that we've done to our kids. Like, I did a recent post on like one of the scariest things, like, this, I think it's okay to talk about this. I can't believe how apathetic the youth is. Like, when you think about, I mean, I'm older than you guys, but similar age, that if you're in university, young, healthy, and we have data to support you to say that you really don't have much to worry about when it comes to COVID, and they're adding restrictions. You can't be in class. You can't wear a mask. You have to wear a mask. All these things, and there's no uproar. There's no one on the streets. There's no rally. That to me was nuts. That really, to me, that was scary, because even like, not to be stereotyping, like I live not too far from on the Quebec side, right? And Quebec students would strike for not having lead pencils, like all these things. Like, it was like the littlest thing, and to me, this wasn't drawing more pushback from our youth, our future leaders, the ones that are gonna need to continue to look at things critically and stick up for themselves. And like, there was no push at all. Maybe there was, and we're not getting covered, but I would have expected way more pushback.
But do you think that's sort of embedded in the wokeness that's been infiltrating schools? So pre-pandemic, this was happening. It was very draconian measures of canceling people who were coming to have a debate or give a talk on something that they felt was going to offend certain people. Like, I feel like there was an appetite for really aggressive measures to shut down things that they didn't want to happen. And these lockdown measures are very similar mindset, and it's all about protection and safety. Now, I wonder if this generation that's at that stage right now is, they don't have that more activist mindset in the freedom sense.
Yeah, no, that's a good point. And either way, it's scary, man. Like, I don't know. Like, this is one of the things that, so I got three kids, and this is something that my wife and I are proactively encouraging. I'm like, you boys, You stick up for those that can't stick up for themselves. You don't be shy to speak. We will support you. This is you get passionate about something, rise up. Watch your dad, watch your mom. Watch your mom who spearheaded a rally on having our kids not back at school in June of 2021. Watch that. Let it sink in. Because this is what it's like. This is what it should be all about, being a Kyeremanteng. This is what it's all about, to be a kid, like to be a future leader. You know what I mean? Like, you don't sit on the sidelines. None of this. You know what I'm saying? Like it's just, you know, you go through this time, like, not to get too personal, and you really question, you look at your values. You really reflect on your values, what's important to you. And I was really surprised as a city, province, for me, that we didn't have more of that value of, you know, sticking up for those that can't stick up for themselves, doing the right thing. Like, that's the Canada I know. I mean, I grew up in Western Canada, and I truly believe, I don't know if this is controversial to say, that where I was raised, a lot of this shit would not fly. You know, like, growing up in Edmonton, no way, we wouldn't let this shit fly. And I don't know. I just felt like more of us needed to have that, like, lean on that value. And so, yeah, for me, my kids, like, if I'm raising my kids proper, this is something that has got to be instilled in them too. Like, it's highly encouraged that you are going to stick up for little Tommy that's getting beat up or whatever. Like, you stick up for them, you stick up and do the right thing. That's what it's all about. I don't know why I said Tommy.
I think that applies to this, Tommy. It makes sense.
Because Tommy looks huge. I don't know. It's the opposite.
It's a filter.
This is something that I thought about quite a bit over the past couple of years, and I don't necessarily have the right answer, but it does seem like there is activism in our youth, but now activism is compliance, right? Like, complying with the rules has become the form of activism that most of our young people take, and their rebellion is against the people who are doing the actual activism, right? And also, now that most of our youth, their social world is online, they can go online and be one thing. They can go online and be this social activist for whatever the current cause is. But then in real life, there is no actual on the ground meaningful activism, because they can exhaust. You know, when you're young, it doesn't matter right or wrong. You're for and against things. Like, when you're figuring yourself out, and through that process of figuring yourself out, is that I'm for this, I'm against that. And now I find young people, they do that in the shadows online and scratch that itch. But then, like you mentioned, in person, they're a bunch of wet noodles. And I know that might be insulting, but when you can exhaust your need for activism and confrontation at that age in an online world, there's no need to actually step up to the plate in the real world. And it is like that age group, especially, you know, late teens going into university, they're the people that are supposed to be fearless in standing up against authority, in standing up against establishment. But now it's become the complete opposite, where whoever stands against authority and whoever stands against the establishment becomes the enemy online for our young people now. And yeah, it's a huge concern for me. And my wife and I had various conversations about that, especially with our kids in school, because I was very vocal with teachers, principals, boards, in constant communication with my disappointment with where things led, their hesitance to stand up for their students and just follow along with whatever the province or the federal government said, without actually standing up for the kids in the school and doing what is right. And of course, you know, my wife was took some issue and hesitancy with me creating an adversarial relationship between us and the school board, and I think those concerns I think those concerns are worthy of concern. But I would say to her, Like, now's the time where you stand up for your kids, and now's the time where you decide like who you want to be as a parent for your children. And just sitting back and saying we're completely uncomfortable with these things that are happening, but we're not going to say anything because we don't want to rock the boat. Like, that's not being a strong parent for your kids, and that's setting a terrible example for them. And when my kids are old enough to look back on the history of this situation and ask, well, what did you guys do? You know, there's like, my kids are 3, 5, and 7, so they're a little on the young side to, you know, remember this time of their lives. But when they ask about it, which they probably will, I want to say, like, we stood up for you. This is what we did. This is how we stuck out our necks during this time, knowing that we're very well going to be attacked and get our heads chopped off. But it's not about that. It's about what we believe in standing for and how we believe in standing for you. And yeah, I was always, go ahead.
Amen. Yeah, I'm just saying amen. That's exactly, exactly it. It's exactly like it's about the kids. It's about doing the right thing. And that was a huge driver. And if we're not going to do it then, when are we going to do it? That's the way we were just like, you know, like when, and because they needed us. And like I said, I mean, we're good friends with a child psychologist. They've never seen this much pathology ever. Like, it's real. Like, I don't care what motherfucker, like, what these people online on Twitter saying downplaying this stuff. I'm sorry, it's real. And to just know that we weren't going to do something about it to address it. Like, I always give this image when we were talking about more school closures. Imagine you're a kid on the margins that was that is the child abuser is at home and normally was going to go to school or to the coach when things are getting tough. And we willingly, knowing the data that we had available, not during the first, but like the second or third school closure in Ontario, we said, you know what? It's okay that you're home. It's okay that you're home alone with your abuser or whatever. We're not giving you that any outlet. That's where our values were sitting. That's what we proud, and for like what reason? This was the message out there. I'm like, no.
And this is the thing that needs to be underscored is, you know, in the aftermath of all of this, there needs to be a hard look at the numbers to go, was any of this worth it? And, you know, anything that I've seen tells us that no, absolutely not. Like, none of these measures actually amounted into anything actually worthwhile, and probably just ended up causing more harm than good. So I'm cognizant of the time, and I want to bring this full circle. So just getting back to the cardiometabolic health bit. So I'm wondering now, at this point, as we emerge from the pandemic, what are your plans now for the future, Kwadwo, in terms of continuing advocacy for improving cardiometabolic health in populations? I know you got a grant recently for chronic disease reversal in racialized communities. Like, so where do you go from here?
Yeah, great question, Andrew. It's about being the example, like just showing, just looking at innovative ways that we can make a difference. And, you know, like many things, I'm a big believer of you just keep swinging. Like, I'm not an analysis paralysis cat. Like, we have an idea and we're going to see if it works. You know, we tried that with like, for example, Solving Wellness. With this one here, we're going to offer in-person and virtual options for hardest hit communities. You know, I'm a big 80-20 fan. Like, always try and look at the area that will give us the biggest bang for our buck. And so looking at a racialized community in Ottawa here, and provide them with a level of expertise through health coaching, through you know, having nutritionists, exercise programs, in group sessions, and individualizing care, and seeing if this is a model that could work at scale, you know. But the point is, let's prioritize this and let's try something, because I'm just a little bit sick of, I'm sure you feel the same way, sick of us in healthcare approaching the same problem with the same solution and expecting different results. Like, our healthcare system's in crisis, and it's always the same talk. It's always the same shit, and nothing changes. So, you know, it's going to take some more innovative approaches, and maybe this will work, maybe it won't. But I'll tell you what, we'll swing the bat, and if it's not working, we'll pivot. that's to me is the way we need to be approaching healthcare right now.
That's awesome. All right. Tommy, do you have any other questions you wanted to touch on?
Yeah, well, just on that thread of how we can change the healthcare system in order to better serve the public in the most effective way. Do either of you have thoughts on Doug Ford's recent move to bring in privatized systems to serve the public healthcare system? And I want to preface this for people who are listening, because I think a lot of people misunderstand and think that this is true privatized healthcare. But the public is never paying for those private services. It's just that the Ontario government is contracting private healthcare systems to work on behalf of the public system. Do you guys believe, either within this current framework that Doug Ford's setting up, or even in a truly privatized system or combination system between public and privatized healthcare, do you guys see that as a potential net benefit if done a specific way, or do you see this as a problem?
I'll hit it. So number one, like, privatized healthcare already happens in this country. Try and see a physio, try and see a psychologist. You're paying out of pocket unless you got some wicked plan. Number two, this idea, the fourth plan, I'll just be honest, my opinion is it's logical, like, because once again, you're not paying out of pocket, but you're using a group that is has high levels of expertise and efficiency at going through specific procedures. So they could go through, like, if you're just a random example, if you're doing hips or knees, we'll go with knees at one hospital, you might go through 4 in a day, where this clinic might be going through 10 in a day because of their level of expertise and efficiency. So to leverage that in a time of crisis only makes sense to me. 3, if we ever do like a proper level of privatization, to me, you just need to be cognizant of the risks and try and mitigate them as best you can. For example, I worry always about the talent drain. Like, if I'm an orthopedic surgeon, I could do private clinics. I would just do private clinics potentially. So you would, in my mind, if I was a policymaker, I'd limit the time that it gets spent in the private sector. That way, and they would have to have time within the public sector. In fact, most of their time in the public sector. I do think there is potential upside, though, like in terms of offloading some of that wait list. And I mean, to be honest with you, some of this is happening already. That's just like, you have Albertans traveling over here to get their knees or hips done, paying out of pocket, and vice versa. So to me, if I'm running the show, I would have some framework and policy to make sure that we don't abuse it, and to make sure that that lens of equity and availability is firm within that. And just watch for abuse. Like, that's the thing. Like, we don't want to be the US, but we need to do something different.
Yeah, I fully agree. And everyone pays for healthcare. You just look at your tax return, and 40 to 50% of your tax bill at the end of the year, that's healthcare dollars. That's what you paid for healthcare, whether you used it or not. And prevention is not covered under the Canada Health Act. So we just spent a whole hour talking about the fact that we need prevention. And that's something that's going to have to be funded separately, unless somebody wants to take the bold step at the public level to fund that too. But I mean, there's so many problems, and to say that, what are we protecting at this point? You say we want to have equal access for everybody, and if you create a private system, you don't have equal access. They're like, what about people who have died in the emergency department? They didn't get even the access that they needed to at all in the publicly funded system. So we have a health human resources problem. We need to train more people. Your point about at the provider level, them going where the grass is greener, absolutely. That's just behavioral economics. That makes sense, and you have to build on those safeguards. but we also just need the right number of people to do the work to meet the demand. And so it's going to take a lot of different solutions. But for this specific thing, it's always that nuance of there's private delivery and there's private payment. This is private delivery with public payment. There's no problem with that. That already exists. And for what they call focused factory type settings or procedures, it makes perfect sense to use the efficiencies of a dedicated surgery or clinic setting to do one skill really, really well. You know, hernias, cataracts, hip and knee surgeries are all great examples of where that doesn't need to be done in our giant tertiary care hospital, where they're fighting for OR space with people who are coming in with fractures and exploded appendix and, you know, who require heart surgery and other urgent things. Like it's a whole morass. But anyway, does that answer your question, Tommy?
Yeah, I find it very, and I'm sure you guys do as well, but I find it strange, if not shocking, that we put almost $0 into prevention. We put very little effort into subsidizing healthy food to make actually healthy whole food eating affordable for the majority of Canadians. We put no money and effort into those spaces, but are yet hesitant to move to any sort of privatization for surgery, for any sort of like medical intervention down the line. Like that just seems absurd to me. It seems like it should be the opposite. Like I understand we want publicly funded healthcare for emergency situations. Anybody in any socioeconomic demographic has access to the care that they need. I get that in people's hesitancy to move to privatization at the cost of those services. But if you have someone who's willing to pay $10,000 to get a knee surgery because they have the means to do it, why would you not want to allow that person to get that surgery and even tax a significant amount of those privatized funds and put it into preventative healthcare that's publicly funded? Like I don't understand. We're supposed to have very smart people inside of these different governmental systems, which is, of course, you know, some people would argue against that. But if that's the case, how come they can't figure out how to create systems within government and public healthcare that is actually optimized to serve the end user, which is the citizen? And to me, this is just one of those examples where, like, what is it in your mind that can't see the possibilities of making the system better for everybody without these sort of, you know, dogmatic blocks in thinking?
Change. People are so just resistant to change. It's a lot of things, but that's to me one of the anything that's different against the grain, resistance.
Yeah, I was listening to a podcast yesterday that had Rick Rubin on it, and there was a point where it was actually on Andrew Huberman's podcast, and he was talking about when researchers covered up that there was that neuroplasticity didn't end at 25 years of age, and they actively covered it up because it would go against the research they'd done. And Rick Rubin said, you know, you have to understand that's not the only time that something like that has happened. And he said, oh yeah, but there's, you know, in that field, it's a small cabal of people. And Rick Rubin interrupted and said, every field is a small cabal of people, and they're all interested in keeping things the same because it's what serves them best right now.
Yeah.
And I heard that quote and I thought that's everything everywhere as far as these things.
It sounds like we're gonna have to have a part two and keep this conversation going, but I think we should call it there for the day. So Kwadwo, thank you so much for taking the time to chat with us, and yeah, we'll find another time.
Andrew and Tommy, this was balling, boys. This was a lot of fun. Thank you so much for having me.
All right, take care, man.
Yeah.